you know, lipoproteins is basically in the lipid classification we discuss about the compound lipids. This is third and most important subclassifications of the lipids, that is compound lipids or conjugated lipids, in which lipids molecules make the conjugation with other molecules which we called proteins or carbohydrates. Okay. So the question is that why it is important, these molecules, why there is conjugations. Okay. As you know that if we see the definition of the lipids, lipid are the molecules which are insoluble in water and soluble in organic solvents. Okay. And these lipids molecules are not being soluble in the blood also, because in the blood there is major proportions of water as in the form of plasma fluids. Okay. So these molecules are not able to soluble in the blood. For transportations and storage purpose, we need these lipoproteins molecules. Okay. So we need these conjugations molecules because it contains some amphipathic lipids, okay, and some non-polar lipids in the conjugated forms. Okay. So these are short answer questions generally asked in your university exam. So first is definition, what is lipoproteins? So lipoproteins are the conjugated molecules which contain lipids and protein in their structure. What is lipoproteins? Lipoproteins are in their structure. Okay. When we see students, when we fractionize these lipids molecules, which is total lipids molecule which is present in the blood, they are being separated on the basis of their density and on the basis of their electrophoretic mobility. So on the basis of density is what? Those molecules which is highly conjugated, which contain more proportion of proteins, are separate first and settle down first, and those molecules which are having low proportion of proteins are settled down next time. So let me see the diagram first. This is the rotating test tube in which we rotate the lipid fraction molecules, and we see that how it is being separated, how it is lipid molecules being classified on the basis of density. This is the first separations of these lipid molecules or fat molecules. It is called chylomicron. Chylomicron. Now, second classification on the basis of their density is VLDL. VLDL stands for very low density lipoproteins. Very low density lipoproteins. And third type of fractions which we consider as IDL. IDL is basically intermediate density lipoproteins. Intermediate density lipoprotein. Okay. And the fourth one is LDL. LDL. After HDL, this is HDL, high density lipoproteins. Last one, there is some FFA molecules are deposited on the basis of density. FFA stands for free fatty acids. Okay. So when we centrifuge a whole lipid molecules of the blood, we get such type of fractions. How it is fractionized? On the basis of density. Madam, you have some work, urgent work? Yes, second one, first row. Yes. And this is the first classification on the basis of what? On the basis of their density of different lipoproteins molecules which is present in this molecules. Okay. Now, the second separation is on the basis of electrophoretic mobility. So, in the electrophoresis, there is the appearance of separate bands. The separate bands are appear on the paper. So, on this paper, we identify the different molecules. Now, we see the structure of this lipoproteins molecule. So, okay. So, these types of classification we got either two main important process. The first one is on the basis of density and second one is on the basis of electrophoretic mobility. Now, we see the main structure of the lipoproteins molecules. This is the phospholipid which is present in the molecules. I think we should understand with this diagram actually. Okay, this is the structure of lipoproteins which consist peripheral apoproteins. Okay, this is basically a kind of apoproteins you already understand. It is same like the enzymes, apoenzyme, prosthetic groups and other groups. Okay, here we talk about the conjugations, means there is a attachment of two molecules, here the lipids molecules and proteins molecules. Okay, and the protein part which is attached with this lipid molecule is known as apoproteins. And these apoproteins is very important because it have separate class, and these separate class is helpful for different HDL, LDL molecules. Okay, because when we see the lipid profile, you know, an investigation report of the patient, okay, in which we see all the lipids molecules ranges in the diagnostic purpose. Okay, the level of total cholesterol, triglyceride, HDL, LDL, VLDL. Okay, from this HDL, LDL, VLDL, triglyceride, we diagnose a disease. Okay? And why it is important to discuss about these lipoproteins during several diseases, like in the case of diabetes mellitus, when the person is not able to utilize glucose, they take fat as an energy source. Okay, so how these molecules become helpful, how these molecules storage fat become utilized and metabolized. So for transportation, for transport of these all these lipid molecules, we require these lipoproteins. Okay, we require this HDL, we require this LDL. Okay, so this is the conjugated structure of these lipoproteins, which contain phospholipids as a outer layer, free cholesterols, triglyceride, cholesterol esters, and core of non-polar lipids. Okay, and these are peripheral proteins and these are integral proteins. You already know the difference between peripheral proteins and integral proteins, because we complete all these types of protein during the structure of the cell membrane. We already completed it. Okay. So this is the structure of lipoproteins molecules. Now we see all the classes of lipoproteins molecules with their function. Okay. The first one, lipoproteins, chylomicrons. Main apolipoproteins is what? B48ACE. This is the subclassification of this apolipoproteins, and it is important for the activation of enzymes. It is important for the activation of enzymes and for inhibitions of enzymes. Okay. So you just understand that the function of apolipoprotein is what? It is required for the activation of enzymes and for inhibitions of enzymes. So ultimately what? By the activation, it can regulate the pathways. By the inhibitions, they can inhibit the pathways. So in the next upcoming classes, we discuss all these apolipoprotein classes in detail. Okay. Major lipid content, dietary triglycerides, site of synthesis, it is synthesized in the intestines. Student, very important. Where it is synthesized? In the intestines, and hydrolysis by lipoproteins, lipase. These are the enzymes which can hydrolysis these chylomicron molecules. So chylomicron is helpful for the transportation of dietary triglycerides. What is the function of chylomicron? It is helpful for the transportation of endogenous formation of triglycerides. Okay. Second one is VLDL. It contains B100 and CE as a apoproteins, which is for endogenous triglyceride. It contains the synthesis of this VLDL is liver, and it is again hydrolyzed by lipase enzymes. VLDL and HDL. In this, all this classification, LDL and HDL molecule is very important, because we call this LDL molecule is a bad cholesterol and HDL molecule is a good cholesterol by some properties like atherogenic properties, anti-atherogenic properties of HDL. We discuss and we understand why it is to be called good cholesterol and bad cholesterol. Just I give the hint today that LDL is the best cholesterol because it can deposit the cholesterol from liver to extrahepatic tissues. Okay, these LDL molecule is a carrier for cholesterol and other lipid fats molecule to deposit from extrahepatic tissues. But rather than HDL, HDL process reverse transport cholesterol mechanism through which it can metabolize all the lipids molecule which is present in extrahepatic tissues. Okay, So it is very important to maintain the lipids fractions molecule in a normal range. VLDL majorly contain B100 apolipoproteins, plasma VLDL, receptor mediated endocytosis, liver and other tissues. HDL, it contains separate other classes of apolipoproteins. Okay. Okay. So the question is comes, what is apoproteins? Okay. Apoproteins is a protein part of lipoproteins. The function of this apoprotein is basically activation of enzymes and inhibition of enzymes. Let me see the percentage distributions of all these molecules in different molecules through this chart. You understand that? C stand for cholesterol esters. Cholesterol esters. In chylomicron, the percentage of protein is 9%, triglyceride is 90%, cholesterol is 1%, and cholesterol ester is 3%. VLDL contain 10% proteins, 55% triglyceride, 10% and 15%. IDL 10%, 30%, 10%, 35%. LDL it contains 20% protein part, 15% triglyceride, 10% cholesterol, and cholesterol esters is 50%. And last one very important, this is HDL. In the HDL, the lipid portion is more, which is 50%. This is 15, 5, and 30%. So this is the content ratio of all these molecules that have okay that have in their structure. Now all of you understand the basic function of this chylomicron. What is the function of chylomicron? Transport of exogenous Tg from intestines to muscle and adipose tissues. The function of chylomicron. What is the function of chylomicron? Transport of Tg, exogenous Tg, that is dietary Tg, from intestines to muscles and adipose tissues. This is the function of chylomicron. Function of VLDL, transport of endogenous Tc, process liver to tissues. So chylomicron and VLDL are specific for triglyceride transportations. Okay. IDL basically cholesterol. LDL, it is transport of cholesterol from liver to peripheral tissues. Means it is helpful for the transportation of cholesterol from liver to extrahepatic tissues. And HDL molecules, it is helpful for river transport cholesterol mechanism from tissue to liver, from extra tissues to liver. Now, these all are the classifications of the lipoproteins, how it is classified, what is the content ratio in their structure, and what is the importance of this lipoproteins molecules in the lipid profile. So, I think the topic is too short, and from the next class we will discuss about the metabolism of these LDL, HDL in detail. Okay? Yes. क्या पूछा? थोड़ा आ गया आवाज. परसेंटेज ज्यादा आ रहा है. अरे नहीं, वो तो सिर्फ स्पेसिफिक दे दिया, कैलकुलेशन. इट इज नॉट structure. When we see the structure of particular chylomicron and lipoprotein molecules, these molecules are present in this proportion. इस proportionate में होगा. एक मिनट में चेक कर लेता हूँ. Okay, so now we also see the normal fractions molecule which is present in the blood. Then we see the lipid profile, that is total cholesterol, what is the range of TC, total cholesterol in the blood? It is 200 mg per dl. Triglyceride, it is up to 150 mg per dl. Okay. HDL 40 to 50 mg per dl. LDL less than 100 mg per dl. Now you tell me, if LDL is increases and HDL is decreases, it is good or bad? Last one. Second row last. Yes. In the high range, low range, and LDL is in high range, it is good or bad for health? Raise your hands who want to give the answer. Raise your hands. Why? Huh? Why? That's why I asking why it is bad condition if the LDL is increases. See the function of LDL. What is the function of LDL? Yes, transport of cholesterol molecules from liver to extrahepatic tissues. If it is transported in more amounts, what happens? There may be a chances of dyslipidemia, hypercholesterolemia. Extrahepatic tissue means what? Your cardiac, okay, your renal portion. So what they cause? They causes atherosclerosis. Atherosclerosis, you know, hardening of the blood vessels. Okay, so due to deposition, more deposition of cholesterol in extrahepatic tissues, they causes different and more and more complications in the body. Okay, if their regular deposition of the cholesterol increases, they causes high BP. There may be a chances of coronary artery disease. There may be a chances of myocardial infarctions and many other disease. So it is important when we see the patients of diabetes mellitus, there is hypercholesterolemia and hypocholesteremia. Both the conditions are occur. Okay, and I can reverse this condition. HDL is more and LDL is low. It is good or bad? It is good for health. By when you see the function of these HDL molecules, it takes cholesterols from extrahepatic tissues to the liver for further metabolism. There means for fate of cholesterol, it is important to increase the value of HDL in the body rather than LDL. Okay? And increased level of LDL indicates atherosclerosis, heart attack and stroke. That's why it is called bad cholesterol. Why it is called bad cholesterol? Because they can increase the chances of heart attack, increase the chances of atherosclerosis. Okay? Why they increase the chances? Because it can transport the cholesterol molecules from liver to extrahepatic tissues. Okay? And HDL is a good cholesterol. Why? Because this can take the cholesterol from extrahepatic tissue to the liver for rate of metabolism. Okay. So in the next class, we go for the metabolism of LDL, VLDL and HDL. Very important topic for discussion. You have to read at least types of apoproteins. Okay. How it is formed. Okay. From the next class, we discuss all these major metabolic pathway for the metabolism of these LDL, VLDL and HDL. Thank you.
Questions will ask about the blood group and RH incompatibility, ABO incompatibility will be asked in oral and also theory. So go through the books and that's very important for your career also. Kotha bolbi na keu. So let's start. Today is endocrine system is very tough one and it's a huge chapter. I hope the 2 to 3 teachers will cover this endocrine system. Now my question is why it is important and why we should know about this. Anyone? What do you mean by endocrine system? Anyone? বল 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 না যা বল ভুল বলবি ঠিক বলবি কি আছে you are hormones regulations okay good sit down any other one so take a example of a clinical scenario okay a baby of 4 months suppose 8 months of age is presenting with delayed development okay number 1 number 2 lethargic. Number 3, history of constipation. That means infrequent stool pass for this baby, and dull look. That is dull look. So it is a 4-month baby having a delayed development, lethargic, history of constipation of infrequent stool. Any patient is come with these such symptoms, then we may think about, yes, yes, hormonal problem, yes, no idea. That is expected that you have no idea. That's why I am here. So there is must be a clinical features of thyroid problems, or that the presentations will be hypothyroidism. So that's why any patients like that, such a symptom, some patients with older ages, like 5 years, 6 years, may come with us. There is a lack of concentrations, lethargic also, history of constipations. We just do a free T4 and TSH that shows the TSH level is high. That means subclinical stage of hypothyroidism and must be treated. And in this case, already in late, if this baby having congenital hypothyroidism, that means 8 months is permanent loss for his or her brain. So congenital hypothyroidism is a big entity, and the big toughest job to us like child specialist as a pediatricians is big challenge to identify very early to congenital hypothyroidism. That means you have to keep in mind knowledge that some endocrine system or some hormones are there. There must be important for your class, not only class, it is day-to-day life also. In our day-to-day life also, there is sleep, eating, metabolism, growth, development, chemical changes, key gochis, anxiety, depressions, all are controlled by our endocrine system. So endocrine system is important. It is essential. Now the question is that what is the difference between the nervous system and the endocrine system? Anyone? What is the difference between the nervous system and endocrine system? We know that is nervous system. Yes, very good. Very, very good. That is a first. And always constant firing is going on. In case of endocrine system, this is slow, and also it is secreted when needed. আমার যখন লাগবে তখনই বেরোচ্ছে। আমার রাতের বেলাতে লাইট বন্ধ, মেলাটোনিনের ফাংশন নেই। দ্যাটস ওয়াই আমার ঘুম আসছে, খিদে চলে গেছে, খিদে পাবে, এনার্জি কম, মেটাবলিজম দরকার, একটা বাচ্চা বাড়ছে। So these are growth and development by the help of growth hormone secreted from the pituitary. So this is some glands which secretes a chemical messenger or chemical substance that acts to the distant part of our body. That is a hormone. Now, one of the important thing is that the nervous system having somatic and autonomic. Somatic and autonomic. But in case of endocrine system, it is always autonomic. Automatic হবে, autonomic. আমি বলবো এই তুই এই বেরো, growth hormone তুই বেরোবে না। It is automatic. Automatic does not mean autonomic, but autonomic means it will secreted when it is needed. Somatic means আমাকে বলতে হবে, আমি হাতটা তুলবো, আমি ভাবছি। That is a spontaneous response. আমি চকটা ধরে আছি, spontaneous response is there. So constant firing is there. আমি কথা বলছি, constant firing is there. আমি চক নিচ্ছি, আমি ওখানে যাচ্ছি, my thinking and cerebellum is active to plan what to execute. That is the nervous system. But if I feel now I am very sleepy, I have so much anxiety, and you are also during the fear, during the anxiety, your growth must be there, your secondary sexual character must be increased day by day, and that is the role of hormones are there. So nervous system is another entity and endocrine system is another entity, but there is must be some connections. Who are the CEO of endocrine system? Who? Chief Executive Officer, hypothalamus. Very good. So learn like that. Not take any pressure from my lectures that what is going on. No. Learn and adapt yourself to learn something like a very interesting way. So is a hypothalamus is a part of our brain that connects between the neural and endocrine system. That is the CEO of our endocrine system. Now, what is our manager, general manager? Who? Pituitary gland. Very good. So, in this way, you have to think, you have to learn. Total endocrine system will be based on this way. Is a huge chapters are there. There's a huge numbers of hormones, but you have to before going to details. This is a introductory class of all, and so first of all you have to understand what do you mean by endocrine gland. Before that, you have to understand what do you mean by autocrine, what do you mean by paracrine. এগুলো পড়েছিস তো? So tell me, what is the meaning of autocrine? Anyone from this side? Hey, you, first bench chole aaye. You, yes, come here. So, what do you mean by autocrine? Autocrine means, the HS এর পাঠ রে। Autocrine means, কিছু পড়ে আসিস নি? Autocrine, paracrine, হ্যাঁ? সে কি রে? Autocrine, paracrine, and the endocrine. কথা বলবি না, আমি কিন্তু বের করে দেবো। These are the terms very important before going to the endocrine system. It's the basic. You have to clear the basic, otherwise very, very tough. Autocrine means any gland releasing something which has very much more deeper concentration, high concentration of that receptor present here. এইগুলোতেই এসে কাজ করবে, অন্য কোথাও যেতে হচ্ছে না। Autocrine. So any chemical released from a gland, such type of gland which acts on that gland due to the higher concentration of the receptor of the chemical. Finish. Paracrine. গ্ল্যান্ড থেকে বেরোলো, পাশাপাশি যদি কিছু থাকে সেইখানে রিসেপ্টর আছে, they will act here. So any gland releasing something chemical which acts in the neighbor site having higher concentration of the receptor acts on this chemical. Now the question is that, sir, আপনি receptor বলে যাচ্ছেন, what do you mean by receptor? Do you know the receptor? General physiology তে হচ্ছে receptor, biochemistry তে receptor হচ্ছে, what does it mean? হ্যাঁ বল কি? Transmembrane protein. Okay. Not only that may be sit down. That only transmembrane means throughout the membrane, right? This is a membrane, lipid bilayer membrane is there. Receptor ও যেটা বলছে সেটা হচ্ছে আমার transmembrane আছে. Not like that. That may receptor may be intracytoplasm, that is cytoplasmic, that may be internuclear, that may be also nuclear, that may be also cytoplasm, that may be only the surface. So these are the receptors for the ligand. The ligand may be any chemical changes. Hormone is a first messenger or primary messenger, is a hormone, is acts as a ligand into this receptor. So this paracrine gland acts to release something, chemicals which acts neighboring cells or neighboring target organs or neighboring target site having the receptors. Now my concentration is endocrine. What do you mean by endocrine? Endocrine means it releases a gland and is go through the blood, and then again there's a receptor which is coming on. It is, suppose this is a hormone, the hormone receptor ekhane ache, but that does not mean These hormone will not go to the others organs. Jabe, but will not work because the density or the concentration of the receptor of that hormone is present only in the specific or particular target organ. That is the important. একটা হরমোন বেরোলো আমার মনে কর সাপোজ কাকে ধরি থাইরয়েডকেই ধরি. Before the thyroid hormone is our CEO that's releasing the thyroid-tropin releasing hormone, and then our general manager that is stimulated and release the thyrotropic stimulating hormone, that is TSH, and then it goes in the blood. But this TSH will all act only on the thyroid gland and to increase the level of the T3, T4, reverse T3 and also calcitonin. Thyroid থেকে চারটে হরমোন বেরোয়. থাইরয়েড থেকে চারটে হরমোন বেরোয়, মনে এলো তাই বলে দিচ্ছি. একটা হচ্ছে T3 and T4. T4 is maximum amount, T3 less amount. Reverse T3 is a big entity. I am not going details. Reverse T3 and also calcitonin. Calcitonin is related to the calcium metabolism. Okay, so now this is the endocrine, autocrine, and the paracrine glands are there. Now the question is that sometimes these endocrine glands are called ductless gland. So this means somewhere this is a gland, that is a duct. That is called exocrine gland, right? So exocrine gland means, take example like pancreas. It is called heterocrine gland. Hetero means two rakom. Hetero means two types, exocrine and endocrine. For the pancreas is endocrine to release the insulin and glucagon, and the exocrine means enzymes. Very good. And that's the duct. Definitely there is some duct, pancreatic duct is there. So there is a ductless and ductful or having duct glands are there. In case of endocrine system, all hormones, horny glands are released from ductless gland. Whatever it may be, maybe pituitary, maybe thyroid, maybe adrenal glands, maybe etc. Anything. Now you have to think from head to toe, কোন glands থেকে hormone বেরোয়. But just think and tell me. Just think from above and tell me what is the glands are there. What are the glands are there? Tell me. First of all, there is a CEO, that is the hypothalamus. Remember always, hypothalamus releasing, always the hormones are there. Always releasing hormones from specific nuclei. I will go in details of hypothalamic nucleus, which hormones are coming around, but any overall introductory classes, remember hypothalamus releases the releasing hormones. Hypothalamus releases releasing hormone, right? Growth hormone, releasing hormone. Gonadotropin, releasing hormone. Thyrotropin, releasing hormone. Anything, prolactin, releasing hormone. In this way, these releasing hormones are coming from the CEO, that is the hypothalamus of this. And hypothalamus is the connections between the nervous system and our key endocrine system. ছোট্ট একটা example, whenever you are in fear, কেউ তোকে মারতে আসছে বা কোনো একটা রবারি হচ্ছে, তুই ভয় পেয়েছিস, so our adrenaline gland must be there. Adrenaline release will be there. So adrenaline is the catecholamines. So adrenal gland is there to release the catecholamines. But before that, you are seeing the mob is there and coming. Suppose তোরা ইন্টার্নশিপ করছিস, কিছু করিসনি, একটা ভুল করেছিস, ক্যালারি খাবি, মার খাবি, ভয় লাগছে. So what is will? The mob is seeing. You are seeing the mob, and the information goes to the hypothalamus to release the corticotropin releasing hormone, and then it comes to the general manager, that is pituitary gland, to release the ACTH, and ACTH comes to the adrenal gland to release the catecholamines, and that is the fight actions. Okay, so in this way, whatever you are going to the connections of the endocrine gland and the nervous system is always important. You, first bench, yes. You, yes. Come to the first bench. Please come. So in this way, so these are the facts that we have came across with the understanding of different types of glands as well as their accents. Now, whole throughout the life, some important points regarding the endocrine system is very important. What are those? Any hormone. Number one, where it is secreted, from, which is the triggering factors. These are the important. And what do you mean by positive feedback? What do you mean by negative feedback? What do you mean by primary, secondary, tertiary? These are all will come in every class of every teachers. I am here to you to give a gross idea about whole things. So, giving some example. First of all, primary, secondary, and tertiary. Tertiary what? Suppose primary hypothyroidism. Something is going on, secondary hypothyroidism, and also tertiary hypothyroidism. Now the staging of the glands are important. What do you mean by primary? That means niche wala. Niche ke ache? Thyroid gland. So any problem in the thyroid gland is a primary. Just tar upore ke ache? Pituitary. To release the TSH. Suppose the TSH level is less. And so this is the pituitary. Pituitary is a secondary. Tertiary, ke ache? Hypothalamus. Ki release korchilo? Thyroid topping releasing hormone. That is less. That is called hypothalamus. And this way you can detect any types of primary, secondary, and tertiary. So that's very important. Emon noy je mukhosto korte hobe, kichchu mukhosto korte hobe. Nothing to memorize, not at all. You have to understand what is going on in your day-to-day life. And endocrine system is used to maintain our homeostasis. If anything, suppose you are taking a food in breakfast, that is glucose level is increasing. Glucose level is increasing means you must be something utilize of that glucose. Ke korbe? Insulin will be released. Insulin ki korbe? Uptake barabe. Of what? Excess glucose. That's why our homeostasis of glucose is maintained. So in this way, the primary, secondary, tertiary of any gland and any hormone you can explain. Not only hypo, that also hyper. This primary hyperthyroidism, primary hyperparathyroidism, secondary hyperthyroidism, secondary hyperparathyroidism. That means that is the parathyroid gland which is activated, which is the first, second pituitary, and then it is a hypothalamus. Taking any example of this you can came across with this and this. Suppose gonads, LH, FSH releasing from the testis in ovary, testosterone, gonads, male gonads, female gonads, female gonads, LH, FSH mainly, and the male, that is the testosterone, dihydroepiandrosterone, and also inhibin. So these are the hormones. But control kothay ache? Control is a gonadotropin releasing hormone. Koththeke beroy? Hypothalamus releasing. Whenever we utter the term releasing, always it will come from hypothalamus. No shortcut is here. So anything releasing hormone, gonadotropin releasing hormone is come across. And then from the pituitary, release from FSH, LH. Right? And then it goes to the gonads to release estrogen, progesterone, testosterone, etc. That is sexual secondary sexual character or sexual urge, and also maintain our everything for maintaining the growth of the gonads, reproductions, everything is important. Sterility, unsterility also depends upon this axis. Now the term is called axis. What do you mean by axis? You came across with the axis like that. That is, you remember, hypothalamo, gonadal axis. In this way, hypothalamo, pituitary, adrenal axis also will be there. Adrenal axis will be there. So this is the axis. And also hypothalamo, pituitary, thyroid axis. That also possible. So this is called in short HPG axis. It is short HPA axis. In this way we can go axis. This axis is very important for a menstrual cycle also. দেখবি যাদের রিলেটিভস আছে কোনো ছোট বাচ্চা আছে জাস্ট মেনস্ট্রুয়েশন স্টার্ট হচ্ছে in that case they may gain history also, and mainly all females also may complain that during the starting of menstrual period 1 to 2 years that is very irregular period is there. That means this axis is not established at all. আমাদের কাছে ছুটি ছুটি আসে unnecessary fees দিতে আসে কিভাবে আসে যে স্যার আমার বাচ্চার পিরিয়ড হয়ে গেছে দুবার. It's very easy if you understand the axis. That is not actual. আমরা কি করি চুপচাপ কাউন্সিলিং করে ছেড়ে কিচ্ছু না, nothing. But if it is something is serious, then we refer to the gynecologist. Otherwise, this is the physiological. This is a physiological. There is a concept of endocrine system. So until now, কি শেখা হলো? Autocrine gland, paracrine gland, endocrine gland. Endocrine is a ductless gland that is released from a site, goes to the blood, and target for the receptor in a target tissue or target organ or target cell is there for the respective hormones or chemical nature. I am not details about the hormones. I can't utter, I'm termed rather chemical messengers. Is a chemical substance which released from a endocrine gland, endocrine gland that's via blood. Via blood means it goes to every organs also, but does not act on all the organs. It acts only the specific receptor present on the specific organ. That is the beauty of this endocrine system. And this endocrine system is connected to the nervous system through the hypothalamus. Hypothalamus is our chief executive officer. Don't write that in your paper. It is a main, and then the pituitary gland, and then our target tissues are there. Some axes are there, and first of all, first criteria to understand about every hormone. So there is a primary, secondary, tertiary diseases. Like primary means while it is acting or while it is the main gland, একটু upper level এ চলে যা, pituitary, secondary, and the hypothalamus is the tertiary. That's the number one. Number two, I'm coming, there is a feedback mechanism. Feedback mechanism means positive feedback and the negative feedback. I'm giving an example. Suppose a patient have T3, T4 level is high and this TSH level is low, is happening. It is negative feedback or positive feedback. Another example, T3, T4 is low and TSH level is high. Another example, that is estrogen level is high and LH level is increasing. Which one is positive feedback, which one is negative feedback according to you, up to this your knowledge? Tell me, anyone. First of all, first one, is a positive feedback or negative feedback? Negative. Any? Negative. You? This group? No idea. Negative, and here is negative. This one, I'm coming to the answer. কেউ পজিটিভ বলছে, ভেরি গুড। কে বলছে? পজিটিভ বলেছে একজন, নেগেটিভও বলেছে। এটাকে নেগেটিভ বলেছে বেশিরভাগ, নেগেটিভ। And this one, positive. Now the basic concept to all throughout the light and feedback mechanism is simplest. Whenever is this changing in the opposite directions, always it is called negative feedback. Always called negative feedback for you. This is কমছে, এটা বাড়ছে, negative feedback. বাড়ছে, কমছে, নেগেটিভ ফিডব্যাক, বাট বাড়ছে, এটাও বাড়ছে, পজিটিভ ফিডব্যাক অলওয়েজ, অ্যান্ড দ্যাট ইজ ওয়াই LH সার্জ, দ্যাট ইজ ওয়াই LH, sorry LH না, LH surge is occurring due to the positive feedback mechanism. Two, up to these two important points, that is the primary, secondary, tertiary diseases. Number 1 point was there, and number 2 was the feedback mechanism of our hormones are essential. Suppose our growth hormone বাড়ছে তো বাড়ছেই, you have to suppress না. What to suppress? Suppress the growth hormone release, and also suppress the growth hormone releasing hormone also must be released in upper, up, hypothalamus. So that is a negative feedback. So remember, positive feedback in endocrine system is very less. Most of the control are by the negative feedback mechanism. Most of the control by the negative feedback mechanism. Okay? Now, so number 1 is a primary, secondary, tertiary diseases according to glands or site of the action. Another is a feedback mechanism. Now, each and every hormone is active only in free form. Only in free form. Suppose this is a gland and this is a blood vessel and this is a target organ having a receptor. So this is releasing this hormone and diffuses into the blood, coming. This is a free. But if it is bound to any plasma protein, again a plasma protein is bound হয়ে গেল, whatever it our action exert is action only in the free form, not in bound form. That is the point. Any hormone in the circulation which is in free form is mainly the active form to give our actions, like the physiological actions, metabolism, growth, development, anything. So these are the free form. So these will come and attached to this in this way. So number 3 is gone. Number 1 is a primary, secondary, tertiary. Second is a feedback mechanism. Third is a free active form is there. Now, some hormones are controlled by some glands are basically controlled by the pituitary, and some are the free from the pituitary. What are those? Some glands are controlled by the key. এটা মনে রাখবো, these are the control by the pituitary. নাম কি বলো? Thyroid, adrenal key, cortex na medulla. Yeah, remember always, it is adrenal cortex and it is a gonads or gonadal gland. Gonads. So these are the dependent on the pituitary, but independent of the pituitary glands are কি জিনিস এটা? parathyroid, A, again adrenal, which one? Medulla, and this is P for pineal is dependent. You can write that, but most pineal gland basically depends on isolated gland. It's not depends on two pituitary as a whole. Pituitary is a gland. I'm coming later. This is a pancreas. Other glands are there, like gastrin কোত্থেকে বের হয়? স্টমাক থেকে বের হয়, তাই তো? So there are so many glands which acts localize ওয়েতে তারা করে, but that also acts through the blood. গ্যাস্ট্রিন কিন্তু ব্লাডে যায়, তারপরে নেক্সটে যায়। নিশ্চয়ই তো জিআই ট্র্যাক্ট পড়ানো তো হয়ে গেছে। So gastrin when released from a G cells does not mean they acts on that gland. No, that তাহলে তো autocrine gland হয়ে যেত। There's no endocrine gland. Endocrine gland means you have to go to the blood. Gastrin also. So that is this GI tract also, some glands are there to release the hormone. Yes. So gastrin, secretin, cholecystokinin, these are the small intestine and stomach glands. glands are there and to release the some hormones. Anyway, in your mind for whole throughout the endocrine system, keep in mind that pituitary dependent glands are, that is TAG, that is thyroid, adrenal cortex, and also the gonads. And these are the parathyroid, adrenal medulla, and also the pancreas. Clear? So up to these, the 4 points are primary, secondary, tertiary, feedback mechanism, free hormone only active, and the bound hormone are inactive to perform the physiological actions, and also these one are dependent on this. Now the rules are there. These are the endocrine rules. Basically, these are the endocrinology rules. Now, in the pituitary, some hormones and hypothalamus, some hormones are stored and made. Pituitary quarter part, anterior and posterior part. একটা pituitary gland যদি আমি আঁকি, this is a anterior part and this is the posterior part is there, right? This is a hypothalamus is connected to this. This is hypothalamus, and this anterior part, it mainly store, make and store. Make মানে তৈরি করে আবার স্টোর করে, but in case of posterior only store. Posterior part থেকে কি কি বের হয় রে, নাম জানা আছে? ADH, very good, and oxytocin, very very good. So these hormone here stores, not make. Preparation এখানে হয় না, এইখানে হয়. So this is the fundamental of your glands. So any 6 to 7 hormones coming from the anterior part and the 2 hormones coming from the posterior part. But in case of anterior part, it store, make and store. Better two term, make and store. And this is only store. That means it is M plus S. This is only S, no M. In the posterior part. That is a number 5 rule. So primary, secondary, tertiary, feedback mechanism, freely, not bound, freely hormones are accents, and pituitary dependent glands, independent glands, and these are the anterior and pituitary, whether is store or not, whether is make and store, make and store. Any query up to this of anyone? No. So endocrine system is very beautiful if you understand. There is some general rule. There is some general rule. Whatever you tell me, any glands or any hormones are there. Now you have to think that মাথা থেকে পা পর্যন্ত কি কি গ্ল্যান্ডস আমাদের হরমোন দেয়. Tell me. First of all, hypothalamus, then pituitary, then pineal gland. আমরা ছেড়ে আসছি, pineal gland, then thyroid, then parathyroid, then thymus, then stomachal glands. ওই যে জি সেল, জি আমাদের গ্যাস্ট্রিন বেরোচ্ছে, তাহলে স্টমাক এরিয়া, and then adrenal, কোথায়? adrenal glands কিডনির উপরে থাকে, adrenal glands, then pancreas, then gonads, then anything, any hormones are there, any glands are there. So whenever you are going through endocrine system, always think about this way. মাথা থেকে পা পর্যন্ত কি কি আছে? Again I am repeating: hypothalamus, pituitary, pineal gland, thyroid, parathyroid, thymus, stomach, intestine, adrenal gland, pancreas, gonads, male and female gonads. Okay, so these are all the glands when hormones are released. Now the question is that what are the types of hormones? What are the types of hormone? How it acts? Is a general idea of the general rule is there. Crossly যদি আমরা ডিভাইড করি হরমোনকে, that is non-steroidal and steroidal. Grossly we can divide is a hormone that is a non-steroidal and steroid hormones. মুখস্থ করার কোনো দরকার নেই। Non-steroidal means is a peptide hormones or maybe amino derivative. এখানে কিছু কিছু এক্সেপশন আছে। Now, any hormone acts on distant organ having the receptor of that hormone. It is clear? It releases from a gland, then diffuses into the blood, and then goes into the target organ or target cells or any target receptors are there. From your part, one shouldn't only tell the transmembrane is a receptor. Transmembrane protein is a receptor. Is receptor is a protein? Definitely is not only that, always the receptor is a protein, but mainly receptor is a protein. Is right. In our cell membrane of every cell or every organ, there is some cell and cell membrane is there. So in the cell membrane is a lipid bilayer. Right? Lipid bilayer is there. So in this way, some hormone can cross the membrane and some hormone not able to pass this bilipid layer. By thinking of this, we have divided into two parts. Now you tell me which hormone will pass and which hormone should not pass. Yeah, so steroid hormone will pass. That means it may be termed as a lipid soluble. That may be uttered or may be mentioned that is lipid soluble and this is a water soluble. Now some hormones can pass through this layer. Some hormones cannot pass through this. That means for that hormones, the receptor must be in transmembrane or over the membrane, and those are able to pass, that receptor must be cytosolic or internuclear. এখানে একটা নিউক্লিয়াস একটা এঁকে দে, এখানে একটা ডিএনএ এঁকে দে, চুপচাপ থাক। Right? So, if anything, suppose this is a receptor are there, and this receptor is a transmembrane receptor or membrane connection receptors are there, and there is a ligand binding site. Now, which is the binding? Which is here is the ligand? Hormone is called primary messenger. Remember, this is a primary messenger like a steroid receptor. It enters into the lipid bilayer to act. আমি কি বলেছি, non-steroidal is not passing, but here amino derivative is exceptional for some hormones like thyroxine, but catecholamines it did not pass. Catecholamines did not pass like noradrenaline, epinephrine, etc. So peptides are there and steroidal. কি steroidal? যত androgens আছে or steroid like vitamin D. মনে আছে ভিটামিন ডি? আমি পড়েছিলাম তোদের, মনে নেই, হয়তো আগের বছর। ভিটামিন ডি, it acts after entry inside the cell. Vitamin D, thyroxine, these are the lipid soluble. The peptide hormones never ever enter into the cell, but you have to give some physiological response or some cellular response or cell response after going some signal transductions pathway. What are those? General physiology G protein coupled receptor এসব পড়ানো হয়েছে। G protein কাকে বলে, আলফা বিটা গামা। তাহলে দেখ সমুদ্রের জলে তোরা পড়ে যাবি, আমি যদি ঢুকি এবারে। তাহলে জেনারেল ফিজিওলজিতে সমস্ত ভাবে জেনারেল জি প্রোটিন কাকে বলে, জি প্রোটিন কাপল রিসেপ্টরস পড়বি আজকে গিয়ে, নইলে আমার ক্লাস ফলো করতে পারবি না। And that's very important. It is also in the biochemistry also. For now, these hormones is a peptide hormone. আমি ধরে নিলাম this is a peptide hormone, and this hormone will bind to this receptor present on the membrane. This hormone cannot pass to this, but it have to act as a cellular response. That means some signal transduction pathway is going on. I am giving a very good gist to understand this. Very good gist means term will come, but I can't go details because this is another class entity of general physiology. These receptors are always connected to the G protein. G protein, and this G protein has alpha, beta, gamma subunit. Whenever this binds, when these hormones or any chemical messenger or first messenger is bind to this, some conformational changes between this receptor and G protein occurs. And after that some changes must be there, but before that remember the G protein is coupled with a GDP. The GDP coupled G protein connected to the receptor which can bind with a hormone that is a peptide or it is a type of non-steroidal hormones, except few. So when this binding is happening, some conformational changes are there, and what happens? Ultimately, these gamma and beta subunit gone, and alpha subunit এর সঙ্গে এখানে GDP ছিল, এটা ভেঙে হয়ে যাবে GTP. That will transform into GTP. Now, in the cell membrane, there is an enzyme that is called adenylate cyclase. মাথা একটু ঘুরবে আমি জানি, adenyl বলতে পারিস বা adenylate অনেক বই লেখা আছে, adenylate cyclase. That means it's an enzyme is present. Enzyme means a protein is present in the membrane, and that is activated by this alpha subunit of G protein having the GTP activity into this. এখানে চলে আসে কি হবে? These enzyme will be activated. কোন enzyme? Adenyl cyclase. কি করবে? ATP থেকে cyclic AMP তৈরি করবে. So this enzyme will form ATP to cyclic AMP. Adenosine triphosphate to cyclic adenosine monophosphate will be formed by the enzyme, activation of enzyme adenylate cyclase. তাহলে কি ঘটলো এতক্ষণ পর্যন্ত? Receptor binding is going on by a ligand. Here this is a peptide hormones or primary messengers are there, but this receptor is connected with the G protein coupled with GDP. G protein having 3 subunits alpha, beta, gamma. After the ligand interactions with the receptor, there is some conformational changes of this G protein, and then gamma and beta subunit will go on and alpha subunit connected to the GTP, and this combination activates one enzyme that is called adenyl cyclase, and this adenyl cyclase or adenylate cyclase, it's active after activation it converts the ATP. Cell to ATP আছে, cell আমার সব সময় আমার গ্লাইকোলাইসিস হচ্ছে, so ATP is there. So ATP is converted into cyclic AMP, and this cyclic AMP is called secondary messenger. This cyclic AMP is called secondary messenger. তোদের খুব শর্ট নোট দেয় secondary messengers. So secondary messengers not only the cyclic AMP, there are other secondary messengers are there like diacylglycerol, DAG, IP3. These are all the secondary messengers for different action or different for the mechanism. But until this, cyclic AMP is a main secondary messenger which is responsible for further cellular response. কিভাবে? cyclic AMP কি করবে এখানে এসে প্রোটিন কাইনেজ A কে অ্যাক্টিভেট করবে, and protein kinase, remember always kinase mean phosphorylation. So some enzymes, some channels, some sorts of protein must be phosphorylated to give a cellular response. তার মানে এইটি যখন অ্যাক্টিভেশন হলো, সে সামথিং ফসফোরাইলেশনস করে কিছু প্রোটিনকে ফসফোরাইড করছে, বা ফসফোরাইলেশনের ফলে সাম এনজাইমস উইল বি অ্যাক্টিভেটেড ফর দ্য সেলুলার রেসপন্স। সেটা যে কোনো কিছু হতে পারে। দ্যাট মে বি দ্য গ্লাইকোলাইসিস পাথওয়েতে কোনো এনজাইমকে করছে, দ্যাট মে বি গ্লাইকোজেনোলাইসিসকে পাথওয়েতে কোনো করছে, বা কোনো একটা, সাপোজ এটা একটা মেমব্রেন, একটা প্রোটিনকে একটা চ্যানেল আছে, দ্যাট চ্যানেল মাস্ট বি ওপেন when it is phosphorylated. Normally these channels are closed, maybe anywhere, some, suppose a calcium is okay, the calcium channel, but this calcium channel only open if this is phosphorylated. কে করবে? প্রোটিন কাইনেজে। প্রোটিন কাইনেজকে কে অ্যাক্টিভেট করলো? সাইক্লিক এমপি। সাইক্লিক এমপি কে কে নিয়ে এলো? এটিপি। কিভাবে নিয়ে এলো? বাই দ্য অ্যাক্টিভেশন অফ দ্য অ্যাডিনাইল সাইক্লেজ। অ্যাডিনাইল সাইক্লেজ অ্যাক্টিভেটেড কিভাবে হলো? It is activated by the GTP coupled receptor, and the alpha subunit of the GTP is activates the adenyl cyclase. এটা কেন হলো? After the binding of that hormone. In this way, epinephrine, noradrenaline acts. So the cyclic AMP is a secondary messenger, and also DAG and IP3. I will discuss it in my next class if permits. But now is another part is a steroidal. Steroidal. এটা কি করবে? তার জন্য একটা আলাদা ছবি আঁকা যাক। So up to this, what happens is the mechanism of the hormones. Before that, we come into the types of hormones. Types of hormone means steroidal and non-steroidal hormones. Non-steroidal hormones means peptide or amino derivatives. Some amino derivatives are also like a steroid hormones, like the thyroxine, vitamin D, etc. But in case of peptide or peptidoglycan chains, like hormones like the insulin, glucagon, growth hormone, anything, ACTH, is all the proteins. And so in this way, this can be classified. And the steroid hormones are the androgens. All androgens are steroid. All androgens are steroid means it comes from the cholesterol. That's why. So it's directly bind, or directly it goes into the inside the cell, and then that may connect or bind to the cytoplasmic receptor, as well as, if need, intranuclear receptor coming later. But before that, any peptide hormone or non-steroidal hormones can bind with the receptor, is a membrane present, and then this receptor is connected to G protein, and G protein means some 3 subunits are there, alpha, beta, gamma, and with this GDP is connected to this G protein. But if ligand connects with the receptor, then conformational changes are there, and that's why the beta and gamma gone, and the GDP is transformed into the GTP with the alpha, and that activates the adenyl cyclase. And after the activation of the adenyl cyclase, it converts ATP, which is present inside the cell, converted into cyclic AMP, which is a main secondary messenger. And this secondary messenger activates ultimately different pathway or different signal transductions. Protein kinase A. Remember, for A, I am stressing that A, because there are some kinds of protein kinase C also. There are different actions like that. But this is a protein kinase A. Kinase means phosphorylation must be there. Any enzyme, the name is kinase. That means his role is phosphorylation. Any enzyme having kinase, name in kinase, that means it phosphorylates something. So, after the activation of the protein kinase A, it phosphorylates some enzymes to give the cellular response, or some proteins, some enzymes activation, as well as some incorporation, some channels. Key channels? চ্যানেল গুলো আমার আগে অ্যাক্টিভেশন হওয়ার আগে আমার বন্ধ ছিল, তার দিয়ে আমার কোনো ক্যাটায়ন্স বা অ্যানায়ন্স বেরোনো ঢোকানো করতে পারছে না। বাট ইফ ইউ নিড দ্যাট রেসপন্স, আমার ক্যালসিয়াম সেলে লাগবে, সাপোজ এ মাসল কন্ট্রাকশন ইজ দেয়ার, so must be some calcium inside the cell to the troponin tropomyosin connections. So in that case, this calcium channel must be open. কিভাবে ওপেন করবে? After the phosphorylation. কে করবে? প্রোটিন কাইনেজ A. প্রোটিন কাইনেজ কে কিভাবে অ্যাক্টিভেট হলো? সাইক্লিক AMP। কোথা থেকে এলো? ATP। কেন এলো? adenyl cyclase. Adenyl cyclase বা কেন এলো? G protein receptor ligand. Finish. So now the steroid is a steroidal hormones is a membrane. Suppose this is the nucleus. Suppose the nucleus is this, and this is the DNA is this. Okay. Now suppose this is a hormone. with the steroid. Suppose it's estrogen. Suppose it's the vitamin B3. Suppose it's the thyroxine. Whatever it may be, it will come because it is lipid soluble. So no foundation of this is passed. So this will come, and suppose this is intercytoplasmic receptor are there, and intercytoplasmic receptor is connected with this receptor with the ligand, that means receptor, or this means hormones, and hormones is called the primary messenger. So this hormone receptor complex comes into a specific region of DNA that is called hormone responsive unit or element. Hormone responsive element are there, specific loci of gene. Suppose এইটা হচ্ছে একটা ডিএনএ, এইখানেতে তার একটা স্পেসিফিক লোকাই আছে, and this one along with this hormone is connected to this point. To what? It is a transcription factor. It acts as a transcription factor. Transcription মানে কি? ডিএনএ থেকে এমআরএনএ তৈরি করব, তাই তো? আমি এখানে চ্যাট করে এমআরএনএ তৈরি করে দিলাম, mRNA. So mRNA is there, is formed. Now mRNA যদি তৈরি হয়ে গেল, that means কি? প্রোটিন আসবে. So that will, in this way, this come mRNA, and then this is protein, and this protein gives our cellular response. This protein gives our cellular response. That may be anything. I am not going details into this. So this is a huge thing. Which protein কি কাজ করবে, তার কি রেসপন্স? In this way, steroid hormones acts. তাহলে কি করছে এখানে? Ultimately কি করলো? It's entered into the cell. It binds into cytoplasmic receptor, and then it goes to a specific region of hormone responsive element of the gene or DNA, and acts as a transcription factor. Then the transcription forming the mRNA, then the translation of the protein in step by step. So this protein gives cellular response. Ultimately, our aim is that the hormone which acts in the distant organ in a receptor, it gives এই যাতে আমাদের কিছু cellular response দেয়. That is our target. Any hormones of any types that may react like that. This is as a whole endocrine introductions. I hope you understand 80% of my lectures. If you really understand 80% lecture, the rest of your endocrine system will be very easy, and it will be very interesting, and efficiently you can learn, because this is not for your only exam, it is also a day-to-day practice, also very important. Any queries of this, up to this? Any queries? Any? Can I gist? Yes, to some extent I can gist this. There is a endocrine gland as there, that is a ductless, and this ductless gland enters into the blood, and then go to the distant organ to searching for that receptor where it acts. The receptor different types are there. That is why hormones also different types are there. In the hormone category or endocrine system, there are few points. There is a rule. That is the primary, secondary, tertiary feedback mechanism. Free hormone is active, and also some glands are pituitary dependent, pituitary independent are there. Some pituitary sites, anterior pituitary, some make and store, and some are store only. In this way, we can classify the hormones in mainly two types, that is steroidal and non-steroidal. The non-steroidal is anoderivative, that is some exception as there, but anyhow, there is a steroidal, it comes inside the cell and connection to the receptor present in the cytosol, that may be present in the nuclei also. Anything else, hormone receptor complex bind to a specific point of the DNA that is called hormone responsive element, and for the transcription factor, and transcription is activated to form mRNA. mRNA, after the formation of mRNA, it will form into the translations and then protein, and this protein gives our cellular response. And in case of non-steroidal or any protein or peptide hormones is bind to a receptor which is present in the membrane, because that hormone cannot pass, because it is a lipid insoluble but water soluble. That's why this connects to the receptor, and that receptor connect to the G protein coupled receptor. G protein having the 3 subunit, alpha, beta, gamma. After the conformational changes, beta gamma gone, alpha connected to the GTP, and these activates adenyl cyclase, and these adenyl cyclase activations confirms and converts the ATP to cyclic MP. Cyclic MP acts as a secondary messenger, and this activates the protein kinase A, and this protein kinase A means kinase. Protein kinase A, kinase means phosphorylation. This phosphorylates some required protein to give a cellular response. Finish. Thank you very much. This is my class.
M of the experiment, estimation of creatinine by Jaffer's method. By Jaffer's. Estimation of creatinine by Jaffer's method. What is your procedure? How you do?
So first, we'll take 3 test tubes, mark them as case plan.
Okay. You'll take 3 test tubes. One is lab,
Yes.
one is standard, one is
Yes.
test. Okay. In test, what you will take? Huh? Sample. Serum sample. How much you will take? 3 ml. Then what you will add? Sodium hydroxide you will add and nitric acid you will add. How much you will add? Each one. Next in standard, what you will add?
Standard solution, that is serious.
Standard creatinine standard solution. What is the standard of the creatinine solution? It is standard. What is the standard? The standard. What is the standard? Fifth standard or fourth standard or
Known concentration of
known
solution.
concentration? What is that known standard? That is correct. Known concentration. Very good. Known concentration. That means whatever concentration is there, you know.
Yes.
That is correct. What is that? 2 mg per dl. Not ml. 2 mg per dl. Concentration is 2 mg per dl. Very good. How much you take? 3 ml. And what will you add? Same thing. Nitric acid 1 ml. Saturated nitric acid and 1 ml sodium hydroxide. Okay. Next. Blank. Blank distributed will take how much will take? 3 ml. Again what will you add? Nitric acid and sodium hydroxide each 1 ml. Okay. Why you are adding sodium hydroxide? What is the role of sodium hydroxide?
Alkaline medium.
Makes the medium alkaline. Makes the medium alkaline. Very good. Makes the medium alkaline. Now, what color you will get? Okay, you took all these things and properly mix it and you will go for heat. Okay? No heating. Why? What is the problem? Huh? Yes?
Room temperature area.
Room temperature only. Okay, room. Okay. Why room temperature? Why room temperature? Why not heating? Huh? Cold temperature. Huh? Why room temperature? Why not heating? It is a protein. It is a protein. It is 15 H. So it will not heat. Will not heat. Okay. Then will keep at room temperature. After that, what color you will get? How much time you will keep it room temperature? 10 to 15 minutes. Very good. 10 to 15 minutes. Then what color you will get? Orange red. Orange color you will get. Okay. After that, orange color. Why orange color came?
Creatine complex.
Formation of creatine picrate. Now you tell. What is the principle? Same thing. Medium is there. What you are adding? What color you got? Same, it is the principle. Tell. Anybody can tell? Principle. This is very important.
Creatine
Plus Y plus. Creatine reacts with picric acid. Creatine reacts with picric acid in alkaline medium. How it will form? At room temperature. At room temperature, every word is there that you will just collaborate. That is correct or not? All words is there, just you collaborate, that will become principle. At room temperature, it will become creatine picrate, which is a orange red color complex, and it will be directly proportional to the concentration of creatinine present. Then you will go for measure
Optical density.
optical. You will see the optical density. Where you will see optical density?
Colorimeter.
Colorimeter, not calorimeter. Colorimeter, CO, not CA. Okay, measure colorimeter. At which 520 nanometer. 520, 540 also not. 520 nanometer. Then whatever value will get, standard will get, test will get, and blank will test. Blank also will get value. Then you go for calculation part. What is the formula? Tell. What is the formula? This formula belongs to all quantity estimation. What is that formula? Odium test minus odium blank divided by odium standard minus odium blank into C by D into 100. C by B into 100. This formula is to all. You go for creatinine, sugar, urea, every test that is 100. C by B into 100. Okay? What is C? What is B?
Concentration standard, sir. Concentration of the
Concentration
standard.
of what? Concentration of standard. Concentration
And the volume
of
of
standard.
test.
B is the volume of
Test.
test. Volume of test or volume of sample. Okay? C by B into 100. In creatinine test, C by B into 100. How much it will come? 2. Very good. In case of sugar, blood sugar estimation, it will come 100. Okay. In protein estimation, it will come 6. Like that. Okay. So you got what is the procedure, and next you will get the principle. How we will do? Next you will go for calculator and check it. Okay. So all of you do. 2 parts is there. 2 area is there. All of you do. One point six. Normal value কত?
0.5 to 1.7.
0.7 to
1.5.
different. It depends upon male and female. In male it will come 0.7 to 1.5 or 1.4 or 1.5. Okay. In case of female, little bit lower. 0.5 to 1.2. Then 1.6 means it is abnormal. You can tell 1.5 is the normal value. 1.6 is the normal or abnormal? Abnormal. That don't take it where it what how much value coming. Whatever you see exactly that value you take. It is coming abnormal or normal. That don't think of this things. Okay. Then once it will got abnormal value, then why it came? In which clinical condition why it is abnormal coming? And next question is creatinine. I told what is the storage for? Creatine phosphate. Where it is stored? Creatine phosphate. From which amino acid creatine is formed?
Glycine, glycine arginine,
GAP. Glycine, arginine, methionine. Okay. Finish. Do it. Half of the
three test is low. Standard. T. Blank. Standard.
Okay. Inferior mesenteric artery. So, who would be saying me the branches of celiac trunk? At first, tell me about the abdominal aorta. How many branches it has got? Anterior branches are? Anterior branches are 3. Celiac trunk, superior mesenteric artery, inferior mesenteric artery. What about lateral one? Lateral one. Lateral গুলো কে বলবে? দুই দিকে যেগুলো যায়, কি আছে? কিডনি আছে. So there is 2 renal artery left and right. There is 2 suprarenal artery and another one is 2 gonadal artery. Okay. Then what about the terminal branches? Terminal branches are common iliac artery. Okay. External and internal iliac artery. Okay. Write it down about inferior mesenteric artery. Okay. So please write it down inferior mesenteric artery. So it is the last branch from the last anterior the abdominal aorta. Okay. So who would be saying from where the celiac trunk arises? Celiac trunk arises at which vertebral level? T12. Then superior mesenteric artery between L1 and L2. Okay, and inferior mesenteric artery, write it down. It is from the L3. It is from the L3. Okay, so how does it look like? So suppose this is the abdominal aorta. Okay, so first artery you are having, that is the celiac trunk, that is at the level of T12. Okay, so just below 1 centimeter, next branch would be superior mesenteric artery. Now tell me, superior mesenteric artery would be supplied to which organ? Then from here there are two clinical anatomy. Write it down. Which one is known as marginal artery of Drummond? So what is marginal artery of Drummond? Okay, what is marginal artery of Drummond? And another point is, which one is known as critical Another one is critical line of Sutil. There are two things. One is, what is marginal artery of Drummond? DRUMOND. Okay, so what is that? For knowing that, you have to know these entire colic branches. Whatever it is coming from the superior mesenteric artery and inferior mesenteric artery, it will make one successive branch, okay, towards the periphery of this whole colon. Okay, so these are the, what is this? First one, marginal artery of Drummond. Write it down. These are the numerous colic branches. These are the numerous colic branches which are from superior mesenteric artery and inferior mesenteric artery, which will make successive chain of arteries, throughout the whole colon. Okay, throughout the whole colon. Okay, so this is known as marginal artery of Drummond. Okay, then next one is critical line of Sutil. What is that? So occasionally, write it down, occasionally the inferior sigmoidal artery, does not anastomosis with the superior rectal artery. Does not anastomose with superior rectal artery. Okay, what will happen at that point? Okay, it would be deficient. So this part would be deficient of any blood cell. Okay, so this would be the ultimatum for the marginal artery of Brummel. It would be finished over here. So this part is deficient. Okay, so that is known as critical line of Sewell. Last part of sigmoidal artery, bone anastomos with the superior rectal artery. Okay, so these are the clinical anatomy related to the inferior mesenteric artery. So we have read all the arterial supply. So why it is important for each and every organ? Suppose you are doing any surgery, first thing you have to do what? You have to ligate the artery, right? So for that you have to know which artery are going supplying the which part. Okay, so which are the question I should ask? He said about the rectus C. Okay, so before knowing that I will ask you the random question, you have to answer. Okay, so would be saying what are the 9 planes of abdomen? Yeah. Would be saying, raise your hand. Don't say all. Raise your hand. Would be saying. Would be all. Explain very nice. How you are getting this 9 quadrants? Bible त्रुटि जिज्ञासा करो. बोलो. Stand up and say.
अब क्वाड्रेंट का नाम बोलो, प्लेन बोलो बोलेगा।
Which one is trans tubercular? Tubercle means which tubercle you are saying about? Ilia tubercle. So it would be present at which level? So which one is the iliac tubercle here? What is this? This one is ashes. Okay, anterior superior iliac spine. This one is the posterior superior iliac spine. Okay, what is this? Iliac base. So which one is the iliac tubercle? This one, right? Which one? এটা এটা
মোটা হয়ে আছে
এটা
না
show me.
তুই দেখিয়ে দে তো
So that is the iliac tubercle. Okay, so which plane is running there? That is known as transtubercular plane. Then the next plane, which thing you will take? Transpyloric plane. So it is present where? So it would be crossing the pylorus of stomach. And remember, it would be touching these 2 lines. Okay, both hepatic flexure and the sphenic flexure. Okay. Then what is the other thing you will take? Mid-clavicular line, right? So you will take another vertical cord. So it is dividing into how many quadrants? 9 quadrants. So at first on the right side, first quadrant is right or left? Right hypochondria. Then at the middle you get hypochondria. On the left side, left hypochondria. Then right lumbar on the middle, umbilicus on the left lumbar. Then right iliac fossa. Then hypogastria. Then the left iliac fossa. Now if I will ask the organ, tell me the location. Okay. Tell me the fundus of stomach and the pylorus of stomach. Both are different. কোথায় থাকে ফান্ডাস? লেফট hypogastrium কেন বলছিস? লেফট হাইপোকন্ড্রিয়াম। লেফট হাইপোকন্ড্রিয়াম সবাই কোন সাইডে থাকে? লেফটে থাকে কিনা? ফান্ডাসটা কোথায় থাকে?
Fundus to third.
লেফট সাইডে থাকে। দেন পাইলোরাস,
Right side.
pylorus should be staying towards the epigastrium. That's why any case of there are two type of ulcer. Okay, one is gastric ulcer, another one is duodenal ulcer. Both would be pain would be on the epigastrium. Okay, and to the left side that means it would be related to fundus of the stomach. Okay, then tell me about the liver. Which part?
Right.
It will be occupying only the right hypochondrium. Some part of the epigastrium. Some part of the epigastrium. The spleen. Left hypochondrium. Okay. Then tell me about appendix.
Right.
Right or left?
Right.
So কারো left side থাকতে পারে?
এটা তো পুরো সব অর্গানিজম শিখতে হবে।
ওরে কি বলে?
ভুলে গেছি।
Situs inversus. সবকটা organ reverse থাকবে। They will have dextrocardia, heart will be on the right side, appendix on the left side. Okay, just everything will be reversed. Okay. Then suppose in the left iliac fossa you told appendix. Anything else? Cecum. Heart. Heart की left side है, heart की थाकती है।
Appendix तो right side होता है।
Appendix would be right iliac fossa. Yeah. Anything else? Right iliac fossa है, heart की थाकती है। Cecum বলেছে আর to ভাব আপনি বলতে পারেন। Kidney would be located which side? Kidney কোথায় থাকে? হ্যাঁ? So it is a retroperitoneal organ. It would be present just beside the spine on the both side. Then from the kidney which thing is coming like this? Ureter. So suppose any stone, renal stone or ureteric stone, pain would be felt on the left iliac fossa or right iliac fossa, anything. Okay, so right iliac fossa টা একটা হতে পারে। And in case of female কি থাকবে? Ovary or fallopian. Okay, this is known as adnexa. Okay, that thing also you will get right and left iliac fossa. So right side মানে শুধুমাত্র সবসময় appendix, don't think. So it is known as differential diagnosis. Okay, যে কোনো কিছু হতে পারে। So you have to think. Then tell me on the left iliac fossa. And mainly the descending colon and the sigmoid. Okay, sigmoid colon is the correct answer. Okay, now leave it. Now tell me what are the fossa you will get if you open the abdomen from outside to inside. Which are the fossa?
Open or cancer fascia, thorax.
So these are the coming from where? Fossa transversalis. Fossa transversalis is a condensation of which fossa? ওরাগুলো fossa কেন? লেগে কি থাকে? থায়ে fossa lata. So this is the condensation of the fossa lata. Now who would be telling me the inguinal canal boundary? Anyone? Inguinal canal. From the last. Sir has asked to recapitulate your studies. Don't see. Stand up and say. Inguinal canal. Which are the boundary of inguinal canal? How does it form? What? Dilara? What? Conjoint tendon. প্রথমে হবে কি fossa transversalis, তারপর হবে conjoint tendon. Now tell me how this conjoint tendon is formed. Internal artery plus Lepidopterosis of. So this is the incomplete answer. Okay. Whenever you are saying conjoint tendon of the internal oblique and the transverse abdominis, then most medially কি থাকে? Posterior is a boundary. It will be formed by three things. First one laterally is a fossa transversalis. Then the conjoint tendon of internal oblique and transverse abdominis. Then medial side means towards this canal. Lacunar ligament. Okay. So this is making the posterior fossa. Then what would be the roof? Okay, you see it? Bolo. Stand up. No, you could say bolo. Which is making the roof. Roof कैसे बनता है? Hard part of last one would be the internal oblique, above would be the transverse abdominis. Two things would be there making the roof. Okay, so this is making the boundary. Now tell me on the deep inguinal ring and superficial inguinal is bounded by
superficial হচ্ছে external oblique aponeurosis আর হচ্ছে deep inguinal
conjoint tendon or fossa transversalis. Okay, so now tell me which thing would be coming to the entering to the deep inguinal ring. Only round to কি করে আসবে?
एक्सटर्नल ऑब्लिक और इंटरनल ऑब्लिक के माঝখানে দিয়ে আসছে
কেন মাঝখান দিয়ে আসবে? দুটো স্ট্রাকচার যাবে। What are the two structure? Ilioinguinal nerve যাবে আর in case of male spermatic cord, in case of female down ligament of uterus. Now tell me which should be coming to the superficial ring? These two structure only, right? So tell me how many mechanism is there by that way the inguinal hernia is naturally prevented. First one is flap valve mechanism. So what is the mechanism behind it? ये থাকে flap valve. Right? Which structure is making the flap? যেটা তুই বাউন্ডারি বলি সুপারফিশিয়াল ইনগুইনাল রিং আর ডিপ রিং সেই বাউন্ডারিটাই তৈরি করবে, রাইট? ইট ইজ প্রোটেক্টিং, সো দ্যাট ইজ নোন অ্যাজ ফ্ল্যাপ ভালভ. নেক্সট ওয়ান ইজ শাটার মেকানিজম. শাটার ওয়ান ইজ বাই the external oblique and the internal oblique or external oblique? External shutter. Okay, it is just closing. Then next one is the valve. Sleeve valve mechanism is by then another one is valve by the spermatic cord. Okay, so these are the example by which way the inguinal hernia is prevented. Now, who will define me the difference between the direct and indirect inguinal hernia?
डायरेक्ट इंगुइनल hernia is the right.
Stand up and say. Stand up. Good one.
Direct inguinal hernia is left side of equilibrium and
Left side,
or medial side of the
medial side of the
inferior pituitary, right side of the indirect inguinal hernia. Indirect inguinal hernia mainly seen in the pediatric cases, and direct inguinal hernia is
so you have to say congenital. Tell me which one is a congenital, which one is a acquired?
indirect inguinal hernia is congenital and direct
Direct one is the
genetic or
acquired.
acquired.
Okay. Then any other differences?
This is passes through deep inguinal ring, indirect, and is in the exospect triangle. Direct inguinal hernia.
Is it best? Now tell me, sit down. Which is the Hasselbalch triangle? So I forgot. What is Hasselbalch triangle and how the boundaries form? Hasselbalch triangle এর বাউন্ডারিটা কে কে তৈরি করে? Very easy বলো। How many are there on the medial side? Which muscle?
Rectus abdominis.
The rectus abdominis. In the lateral side?
External iliac fascias.
The external iliac fascias. Okay? And this one nourished by the inguinal ligaments. So this is the Hasselbalch triangle. Okay? So now tell me what are the content of Hasselbalch triangle? So many nerves are there. So this genitofemoral nerve has got divided into two nerves. One is femoral branch of genitofemoral nerve and another one is genital branch of genitofemoral nerve. So which would be the content? Genital branch of genitofemoral nerve. And this femoral branch of genitofemoral nerve is the content of femoral. Okay. Tell me which are the other content of femoral triangle?
Femoral artery.
So you have given exam and you passed. Have you seen your result? Really? আমি তো অলরেডি আপডেট করে দিয়েছিলাম মানে পড়া হয়ে গেছে একটু অ্যাড করে বাস
Femoral artery, femoral vein, blockage lymph node.
it is known as the clockwise lymph node is also known as the lymph node of Rosenmuller. Okay, anything else?
Femoral branch of
Femoral branch of genitofemoral nerve. So this is the one of the content of mone ache. It is one of the content of femoral triangle. Okay. So now about the abdominal aorta I have asked. So that are the branches you know. What are the three anterior branches? Celiac trunk, superior mesenteric artery and inferior mesenteric artery. What are the lateral branch? Again three. What are they? Two left and right renal artery, left and right suprarenal artery and left and right gonadal artery. These are the lateral branch. Then terminal branch are external and internal iliac arteries. Any other artery are the branches of abdominal aorta? By dissection you have seen now one artery will be found on the anterior abdominal wall, that is inferior epigastric artery. Inferior epigastric artery is also the lateral branches of the abdominal aorta. Okay. Now the last question is about the celiac artery. So who would be telling me the branches? Stand up and say. First artery are main three branches. What are they? Splenic artery is not the first branch. First branch. No. Very good. Then splenic artery. Then third one is not common hepatic. You have to say hepatic artery. Okay. Then left gastric. What are the branches? Left gastric आगे जाए branch. Ball. बोलिए तो ball. So first one would be giving the lower end of esophagus. Okay. Another artery is left gastric artery কোথায় যায়? কোন curvature of stomach? Lesser curvature of stomach. Okay. Then the next artery is splenic artery. It is known as the largest branch. So who would be explaining why the splenic artery is tortuous? And which are the other arteries that are tortuous? Srijan. Nah, okay. Which one? Who would be saying which are the tortuous artery in our body?
Uterine and facial.
This one is?
Uterine and facial.
And what about splenic? There are three arteries which are tortuous in our body. Number one is facial. So why the facial artery is tortuous? What would be the cause? Do you know? Every time we are making some kind of facial expression, okay? Or maybe we are chewing, eating food every time. So our this face is always working. It is not resting. Okay? So if it would be straight, what will happen? During working of the muscle, it may got tear. Okay? This is the reason why the facial artery is tortuous. Next one is splenic artery. So why the splenic artery is tortuous? So that is known as number one reason is abdominal distress. What you fast করেছে? Somebody having fasted or somebody starved, okay, and somebody is eating vigorously. Both stomach will be looking same. No. So there will be abdominal distension and the spleen is present where? Just above the stomach. Okay, that is known as stomach vein. Okay, so that's why this splenic artery is tortuous. So that it could give the distension of the stomach. Then second reason is, what is the second reason? Novel.
সব প্রশ্ন আমি কেন
সবাই বলেছে
আমিও তো বললাম
last reason বলে দিচ্ছি due to abdominal distension. Second one is, you are already present in the class. Who are present in the celiac tract? Raise your hand. So what would be the second one? Second reason? Second reason কি আছে? Due to the respiration. Okay, because spleen is present just below the lungs, so it has to move during inspiration and expiration. This is another. These all are hypotheses. Remember, this is not yet confirmed. Okay. Then the third one is twitching. Okay, good. Twitching na? মনে আছে আমার? হ্যাঁ? हाँ, वो उसको तो पता ही है। प्रशांत को सिंपैथी करो। The third reason क्यों? Why the splenic artery is tortuous? Why? It is related to physiology. What? Radial? তুই তো জানিস, then why you are not answering? Okay, because RBC has got the biconcave shape. Okay, so that why it would be distracted in the spleen, it has to cross the splenic artery. So by that way, it could easily distract. Okay, this is the third reason. Okay, so these are the three reasons why the splenic artery is tortuous. लेकिन explanatory note आसे, question आसे, ठीक है? Then which is the next artery? Splenic artery branches. Which are the branches of splenic artery? Go. First one is left gastroepiploic artery. Then second one is this pancreatic artery. Okay. Then the third one is short gastric artery. Okay. Okay, sit down. So what are the branches of pancreatic artery? First one is arteria pancreatica magna or major pancreatic artery. Another one is caudal pancreatic artery, which will be supplying the tail of pancreas. Okay. Then about the left gastroepiploic artery, right? It is a content of which structure, which ligament? Left gastroepiploic artery is a content of which ligament? Lino-renal ligament. Okay, or spleno-renal ligament. Left gastroepiploic artery. Okay. Then the last one is the hepatic artery. So what are the branches of hepatic artery? It's divided into right and left. First one is hepatic artery proper. From that, right and left hepatic artery. Then cystic artery is coming from right hepatic artery. Okay. Then what are the other branch? Gastroduodenal artery. Right? So gastroduodenal artery, which are the branches? What? Very good. So these are the two branches, right gastroduodenal and superior hepatoduodenal. Now tell me which is the content of gastrosplenic ligament. Gastrosplenic ligament content কি আছে? কোন artery? Short gastric artery. Okay, and another content is what? Tail of pancreas. Okay, so these are the content. Okay, so please study. I did not go to the superior mesenteric artery. So there is one clinical anatomy that is known as what is superior mesenteric arterial syndrome. Explain what is superior mesenteric arterial syndrome and why it happens. Alex, sir के की report देते हो? एवरेज बोलिस
आपने रेक्टस सीट जिज्ञेस करना
तू रेक्टस सीट बोल लो प्लीज
ना जिज्ञेस करते
so how the rectus sheath is formed? Stand up and say, be professional, stand up and say.
तो डिपेंड करे कौन लेवल है
Select to explain for Vina, okay? I don't know rectus sheath, now explain.
पर्सनल मार्जिन
What?
पर्सनल मार्जिन এর উপরে anterior wall হবে external of the aponeurosis and posterior wall absent থাকে postal margin আর arcuate line এর মাঝখানে যে পার্টটা আছে anterior wall হবে এর উপরে external of the aponeurosis আর internal public aponeurosis দিয়ে internal ওটা দুভাগে ভাগ হয়ে যাবে আর posterior wallটা internal oblique এর একটা ভাগ যাবে আর transverse abdominal যাবে আর হ্যাঁ আর যেটা postal margin এর উপরে আছে তার posterior wall এর 5th 6th আর 7th রিপটা থাকবে আর যেটা arcuate line এর তলায় আছে ওটা আপনার anterior wallটা তিনটা মাসল দিয়ে তৈরি aponeurosis দিয়ে হবে external oblique internal oblique আর transverse abdominis posterior wall এর শুধু পাশে transverse আছে
Understood? So this is all about the rectus sheath. Okay? Tomorrow we will be having so many questionnaire about the practical question in the dissection. Okay? So get ready, whatever you have studied. Okay? Anterior abdominal wall and this abdominal aorta, these all arteries. Okay? And then gradually one by one organ we will study. Next class onwards, we will just have the questionnaire in the practical and you have to answer. Okay? It will be just like practical examination. ठीक है? खुद ताकि की जाना सरप्राइज प्रैक्टिकल टेस्ट. ठीक है?